My name is Carolyn Hoffman, and I am a doctoral student in the Health Services Research Program at the College of Public Health at George Mason University. I will be presenting a TeachOne for HAP 823 taught by Ronald Woodaman on benchmarking. The question I will be presenting on is from Week 5's homework, Question 2. Question 2 states, the following data reports patients with 10 diagnostic-related groups and 3 HCC indices cared for by a clinician in his peer group. Use SQL to determine if the clinician is more efficient than his peer group. To begin the question, we must first open the data file in Excel and save the Excel file as a CSV in order to import it into SQL. As you can see, I have included a screenshot of the data file in Excel. Next, we must import the CSV file into SQL and read the table into a new query. I have included this code in a screenshot to the right. We must also cast the variables ID, DRG, HCC, and LOS into float variables. I chose to use the alter table code, but you can also use the cast code to do this. We must then calculate the pattern of care for the clinician. I created a temporary table titled Clinician, where doctor equals clinician. I included my code in the screenshot to the right. In addition to calculating the pattern of care for the clinician, we must also calculate the pattern of care for the peer. I used similar code for this and created a temporary table titled Peer, where doctor equals peer. You can view my code in the screenshot on the right. I then matched the clinician and the peer on common strata using the variables created from steps 2A and 2B, creating temporary table match and full joining tables clinician with peer on DRG-A, DRG-B, and HCC-A and HCC-B. I then calculated the overlap without synthetic cases between the clinician and the peer. Additionally, I calculated the peer's performance if it had the clinician's patients. I created a temporary table titled All. Lastly, I calculated the overlap with synthetic cases between the peer and the clinician. I then found the average clinician length of stay, the average peer length of stay, and the percentage of how much more efficient the clinician was compared to the peer. In summary, the clinician had an average length of stay of 2.96 days. The peer had an average length of stay of 3.05 days. As a result, the clinician was 2.78% more efficient than the peer.